Okay.
Okay, everybody, are you ready?
We're ready.
This is going to be very exciting for all you all around the world that are going to be watching this. This is going to make a huge difference in your life. It's probably one of the most favorite half-hour health workshops that I do, because we're going to be talking about subluxation, and it's actually a secret weapon. It's very fascinating. I was talking to a young lady that just left, and she was telling me her husband's been sick already 3 times. He's not a patient yet. And you know, Elise, you've been a patient a long time period. You haven't had cold. Joe, you've been a patient for a couple of years right now. You just don't get sick, right, Bob?
That's right.
Esther, Marie. So it's without medication, and that's even probably one of the most awesome aspects of it. So let's get right down to it. I have a set of notes there. It says, what is subluxation? Subluxation is when a bone, and I'm not saying this to be silly, puts pressure on a nerve. Subluxation is misalignment of vertebrae in your spine, and it stops your body from healing itself. So your body has the ability to heal itself. So when you come into my office and I do an assessment to you, what I'm looking for with the x-rays is that I am looking for misalignment or subluxation in your spine. And you know, one of the things that we've done to everybody when you come in the office, if you look at me right here, you look at your posture. See, if your posture is off, your spine's off. So after Dr. Jim and I do an adjustment to you, do you know how we're always looking at your posture? And have you noticed, as time goes on, that your posture is better and you're taller? And I have some people that say that their feet hang off the table, their feet hang off the bed, or they have to adjust their chairs at home or the chairs in their car. Do you know the significance of that is, if you're standing like this, do you know that your lungs are being compressed and you have less oxygen in your body? So a part of the fact that you're getting stronger and you have less sickness is because you have more oxygen in your body. So the subluxation is when a bone is putting pressure on a sensitive nerve. We'll get into more detail what all that means in a moment. So how do you get a subluxation? Now, this is going to surprise some of you, but subluxations can start at birth. So everybody thinks that the birth process, everything is okay. But you know, one of the worst birth processes there is? A C-section. Because when you do a C-section and they slice the woman's abdomen and they bring the baby out, think about what I'm going to share with you right now. With a birth canal birth or transition from the uterus out of the head has to come out, and it has to have resistance against the vagina. And it comes out slowly, and it causes that little bit of muscle tone. But when you do a C-section, they do the surgery, take the baby out, give the baby a smack on the butt, and the baby's out in the real world. It altered the normal mechanics. The second item that occurs is a forceps baby. If a child has to be pulled out, now you know sometimes I grab your heads and I pull it up in here and it always feels good. Now you have to imagine, if the baby's body is inside the mom and they pull out, that is the beginning of subluxation. Now how I know that is because I'll have parents that will come into the office and they'll say to me, well, my child's been sick ever since they were born. And if they haven't been educated with chiropractic, they're wondering, well, how can that happen? So what I need you to understand, a child could be sick since they were born because they were subluxated from birth. And sometimes you can be subluxated before birth because it depends on how you were laying inside of your mom's uterus. And I don't even want to get into what your mom was eating because, well, the health of your mom and the health of your grandmother affects your health. And it's very huge. It's like, it'd be great if you could choose your parents and your grandparents. So if your mom had a congested liver, chances are you're going to have some issues too. So how do you get them? Starts with the birth process. But let me tell you what really causes subluxation. Very simple today. Poor posture. Now, when I was a kid, and everybody in this room was a kid, we didn't have video games. We didn't have computers. We weren't sitting like this all day. Have you ever looked at kids' postures today? They're like this. They're forward. They need to be like this. So poor posture. Posture is the window to your spine. Poor sleep habits. Now, Dr. Jim works with me in the office here. We have a little baby that comes in. You know, when we check babies, we hang them upside down, and we look to see which way their head shifts. If you ever watch us do this, it's very fascinating, because then we give them an adjustment, and then right afterwards, they're always straight. We had this one particular baby that was always coming in, sliding off the side. So Dr. Jim just made a very logical direction to the mom. Try to let the baby not sleep on its stomach. Try to keep the baby sleeping on its back. You know, when the baby came in the next time, it had less subluxation. So I'm going to share with all of you, don't sleep on your stomach. Because when you sleep on your stomach, guess what you have to do?
Right.
You have to turn your head to the left or to the right. The very best position to sleep in is on your right side with a pillow that keeps your head level. You see, the blood comes back into your body, to your heart this way. So you always want to sleep on your right side. Or if you sleep underneath your back, or on your back, put a pillow underneath your knees. And I'm going to give you a little rabbit trail here, because this is not a posture half-hour health. But some of you snore at night. So when you snore at night, a lot of times you snore and you're laying on your back. Do you want to know why? Because all of your organs are compressing your lungs. And I can tell you a little tip. If you want to snore less, don't eat wheat for dinner. And have hot water and lemon, because it'll cause you to become alkaline. I have found that most people that snore are very acid. Okay, so what else can cause subluxation? We have poor posture, poor sleep habits. I've already mentioned to you what you eat can cause subluxation. I'll go into great detail of that in a minute. Car accidents, slips, falls, and strains. Car accidents, slips, falls, and strains. And let me tell you, in the future, there's going to be an epidemic of kids that have played soccer since they were before they were born. You know, the 2-year-old kids bumping on their heads. That can cause decay in the neck. You see, what I'm learning, and I've been doing this for over 30 years now, is the health of our society is deteriorated. So people can have more of a challenge. Now, I'm going to share something with you that's really important. This is going to be some of the most significant information. Oh, I'll talk to you about that in a minute. It's that referred pain. So what can you do to stop subluxations? First, you don't want to eat sugar. Second, you want to work with your hands like this. If you look at me right here, with your hands like this, pulling your shoulders back. See, when you go, anytime you're going to go stand someplace, instead of standing like this, concentrate. You need to start being aware of your posture to the floor. Do you know that I have a lot of patients that will come to see me because they don't want to be like their parents? I have women that will come and say, I don't want to be like my grandmother. I mean, that scares the willies out of them. And maybe some of you have thought about that. So it's a process. Get one of those large exercise balls and start laying back on that exercise ball like that. That is a good way to stop subluxations in your spine. Wear your seatbelt. Don't participate in any heavy-duty sport. And think twice before going snow skiing, especially if you fall down. Gotcha, Ed. I had somebody right now that's going to go snow skiing. He said, oh, Dr. Bob, you got to adjust me before I go. And I thought, you know what? You're going to need me when you come back. So what's an adjustment? An adjustment is when we correct the malposition of your spine. An adjustment corrects that malposition. You might be thinking, well, what's that cracking noise? The cracking noise is when there's a liquid nitrogen. See, like, here's 2 joints. You turn your attention up here. They have a liquid in here, and when we compress it, that's what causes that noise. That noise. People love, now some people really love that noise. I know that when I give someone an adjustment, and you can just feel that awesome cavitation, that's like the scientific term for it, it kind of like gives you a high. Because your body, you know that right afterwards you get that adjustment. It's like, whoa, what happened to me? And I'm sure that some of you feel like that, don't you? Okay. What causes spinal decay? Mary, can you grab that model that's right behind you? Eddie, or Danny, can you grab that and give it to Mary? Mary, give it to, that's good, and then thank you so much. Okay, now, what I have right here is I have a specimen of spinal decay. This is normal, right here. This is a phase 1. This is a phase 2, and this is a phase 3. Most people that come into my office have either a normal or a phase 1 when they're 40 years old or under. When somebody comes in the office over 40, now listen, because what I'm going to share with you is really significant. Trauma or injury is one of the leading causes of decay in the spine. I can tell you in this part of the spine right here, guys that work at Ford Motor Company, firefighters, nurses' aides, and truck drivers always have most decay right here. And I'm telling you, the guys that work at Ford, because we don't really have people work from GM around here, but the Ford Motor gentlemen always have pain right here because of bending and twisting. Firefighters, because they go from 0 to 1,000 miles an hour, and they're on an adrenaline high, but they don't realize as they're on this adrenaline high, they're causing decay to their body and damage. So decay is when the disc has been damaged, and it's starting to get small. Decay, the disc has been damaged, it's starting to get small, and the body starts sending calcium into the area. Big term. We call that eburnation. It's always a test question, by the way. Not here, but when you're going to college. So the calcium, can you see how that gets narrow right in here? So I had a gentleman that's coming to see us now because his leg is dropping. And they don't know what to do with him. So we started to adjust him And